After the 1994 genocide against the Tutsi, 56-year-old Habiyambere Innocent was one of the few who did everything possible to keep the special tuberculosis service that had started in the 1990s going. He says one of the reasons he decided to work in the tuberculosis field was because it was a disease that affected various parts of the body. Tuberculosis is not multifaceted. It just affects various parts of the body. It can affect the brain, it can affect the body tissues, the lungs, the bones too, especially the spinal cord, and it can also affect the heart as well. Innocent is currently working at the Rwanda Biomedical Center in the multi-drug resistant tuberculosis department. He is responsible for helping everyone affected by the disease to be treated at the Kibagabaga Hospital or the Kabutare Hospital in Huye district. Multi-drug resistant tuberculosis is the normal tuberculosis that is treated poorly, where a patient doesn't take the medication as prescribed by the doctor, or not completing the prescribed dose, or taking medicine that doesn't match with their weight. So instead of the medicine working, the bacteria will get used to it and it will become severe. For a patient to completely heal, it might cost them about 5 million Rwanda francs. So when the patients are many, it could be a serious challenge. He also explains that one of the things that keep him going is being able to take care of patients and seeing them heal. When you follow up with the patients and they heal and you meet them when they are doing okay and are once again healthy, it gives me courage and motivation to continue following up on the tuberculosis patients. I would encourage patients to seek proper treatment and listen to their doctors and treat it before it becomes multi-drug resistant. Because of his dedication that has yielded results, his patients even gave him a nickname. To my surprise, I went on to hear that patients began to call me Holy Spirit, and now it has stuck. Even when I get transfers to other hospitals, the nickname would still come along. I was given that name according to how I cared for my patients well and followed them up. Niyonsenga Devota is a nurse at the Kibagabaga Hospital who cares for patients for multi-drug resistant tuberculosis. She also sings praises for Habiyambere.
Namwigiyeho kuba akorana akazi ke umwete n'ishyaka.
I learned from him because he works diligently and he knows his patients very well. He's very much involved in everything they are going through, whether in nutrition, seeing if they've taken their medicine properly. He's very enthusiastic about his work, and we draw examples from his passion for the work.
Ku buryo ari byo buri muntu wese yamwigiraho mu gukunda akazi.
Tuberculosis is a disease caused by a mycobacterium, or what is called Bacille de Koch. Even with the vaccine, experts in the disease say some of the causes may include low immunity due to malnutrition, HIV, diabetes, as well as cancer. There are between 80 and 110 multi-drug resistant tuberculosis cases annually in Rwanda, and depending on how they are monitored, the Rwanda Biomedical Center estimates that their recovery rate is at 90%, while in other countries the recovery rate is much lower at 42%. There are between 5,000 and 6,000 patients for ordinary tuberculosis annually. Vaccination for tuberculosis in Rwanda started in 1969, and its treatment is provided at no cost. Reporting for RTV, Gloria Mutesi.